Welcome to Balanced Beauty Talks, the podcast where we redefine skin health through a holistic lens.
I'm Natasha, an esthetician and nutritional practitioner passionate about helping you nourish your skin from the inside out.
I'm Dr. Khadija, an esthetician and naturopathic doctor here to explore the natural pathways to radiant skin.
And I'm Alicia, an esthetician and skincare enthusiast. Together, we're diving deep into the world of aesthetics, merging modern treatments with internal wellness so you can achieve long-lasting results without compromising your health.
Whether you're a seasoned professional looking to elevate your practice or someone seeking effective solutions for conditions like acne, you're in the right place.
Join us as we share expert insights, inspiring stories, and practical tips that empower you to embrace a truly balanced approach to beauty.
So get cozy and prepare to transform the way you think about skincare.
Welcome to Balanced Beauty Talks.
Please note that the information provided in this podcast is intended for educational and informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you heard on this podcast. Your health and well-being are important, and we encourage you to make informed decisions.
Hello and welcome back to Balanced Beauty Talks. Today we have a special guest with us, Winnie. She is one of Natology's advanced injectors here. We get a lot of questions all the time about cosmetic injections, enhancements, neuromodulators, which one's the best options, what do we use? And so today we are going to take care of all those questions for you and get to know Winnie a little bit. Thanks for coming. Welcome, Winnie.
Hi, thank you. Hi, everyone. Thank you for having me.
So to start off, why don't you share a bit about your background and what has led you into the world of medical aesthetics?
So a little bit about me and my background. I actually graduated with psychology and nursing degree. And since when I was young, I always know I love like health, beauty, science. And that's why like aesthetic nursing is just kind of like the right calling for me. Even when I was in like university, my part-time job was working at a beauty boutique. I love talking about skincare, beauty with like everyone and learning all about it.
It's like merging it all together.
Yeah.
Cute. So what was your very first injectable treatment?
My first one was back in 2021. I was a model for my friend. She just did her training. I was like debating if I should start my aesthetic nursing journey. So I was like, okay, I'll be the model and just to see what it feels like. And I hate needle. Okay, I'll give it a try. And the result was really good. Like I still look like myself. I just look more awake, more refreshed. And I was like, oh, this is like, it makes me feel good and look good. So I was like, oh, I want to do this. But not going to lie, it is a little bit painful. And I still don't like needle.
I feel like every nurse that's ever worked in our clinic hates needles. Like it's like a thing.
Yeah, it's so interesting. And what do you think you love most about helping clients with aesthetic injectables?
I want to help people like to be their best version of themselves. I think everyone is beautiful and unique in their own beauty. And I just want to enhance that. And I work with my clients and see where they want to like improve on and kind of help them with their skin journey. Aging journey.
I love that you just use the word like enhancements because I think that cosmetic injections can kind of get a bad reputation because there's often, the people that we notice with cosmetic injections are not the best example, but unfortunately they're the people that everyone kind of associates cosmetic injections with. So there's actually a lot more of the population walking around with these injectables, but the point is they're natural and you can't tell and they just look, like you said, refreshed and like themselves, just enhanced. So I love that approach.
I think people underestimate how much of like an art form it is to be an injector. Like it's really takes a trained or like almost like an artistic eye to like look at somebody's face and see where, maybe the symmetry is off or like small micro changes to a face that can really enhance it so much that you walk around feeling really great about yourself. People are really noticing a change, but they just don't know where it's coming from.
And a lot of times it's not even, changing anything, but just replacing what has been lost.
Yeah, true.
So,
So for somebody that's never had Botox or Dysport before, how would you explain what it actually does?
So Botox and Dysport, they are both under we call a neuromodulator. They are temporarily relax the target muscle. So it's like a piece of paper. When you fold it, it creates a line. And then when you kind of like put the paper there, lay it flat, with time, it will kind of soften those lines and creases. So it will help relax your wrinkles, your fine lines. There's also other ways to use Botox and Dysport as well. You can use for like clenching, excessive sweatings. Yeah, there's other medical reasons that people use Botox and Dysport as well.
Yeah, I personally have it in my jaw. It is life-changing. Big clencher myself. And yeah, I think more people need to know about it because
Even
typically you get the solution that I was given from a specialist was a mouth guard. But what it did was enhance the problem because I was clenching on the mouth guard. Like it really, so this has been
yeah.
life-changing.
And it also helps with migraine as well because once you relax those TMJ.
Yeah.
So
What would you say are the most common areas that you treat with neuromodulators and why?
I would say it's upper face. Like the forehead lines, the 11 lines are the most common. And I think that's the first area that people notice first. And they'll be like, I have some like horizontal lines here. And then I feel like once people relax those areas, they also look more awake and refreshed.
Yeah, it does. It just gives you, I think, sometimes you see Botox and I don't know if it's just too much, but they look almost like surprised all of the time. That's really not the norm. I think it just really makes you feel like when you get up, you're like, oh, I feel like I look awake. You feel less tired looking, which is what I love about it. What's a myth or a fear that you wish people would stop believing about neuromodulators?
I think two things. The first, people think Botox will make your face looks weird, natural, or like really, really frozen with like little
like the
Spock.
bug eyes.
Yeah. Which is not true. I think it's just like you have to target the right muscle, the right dosage, and then it will create like a really nice, youthful look. And then the second thing, I think, actually, I have a lot of clients I notice they think Botox is really expensive. It's actually not that expensive. And then once they did the first consultation or like first treatment, they were like, oh, it's actually cheaper than I thought.
Yeah, I feel like we hear that all the time. Like they're thinking it's just going to be like so much money. And then the maintenance on that is like crazy.
Considering, you're splitting it up usually over at least 3 months and sometimes longer.
Yeah, totally.
So my next question was, can people still have a facial expressions with Botox or Dysport or neuromodulators in general?
That I always start talking to clients about it because I notice that sometimes with people's different occupation, lifestyles, they might still want to have some movement and then expression. Like, for example, teacher, they want the kids to know they are mad at them. I actually have some clients saying that. I think it's more, talk to clients to achieve their goals. But the only thing I will mention is that if you do lower dose, automatically the result might not last as long as like 3 to 4 months because your muscle will start moving again, like quicker and faster.
Yeah.
That's the only thing to think about.
That makes sense. So in that case, someone who gets a lesser amount, is it okay to treat them more often? Or do you still like them to come every 3 months at minimum?
I would still like them to wait the 3 to 4 month mark.
Okay. What is the reasoning for that?
I think just for your body to really like metabolize the Botox. Because when you do it too often, your body kind of start having immunity to it. It's rare, but it still can happen. That's why we don't want it to be too often. Yeah.
Makes sense.
So when you come in and you do a neuromodulator injection, how long does it typically take before you start to see the results of like that lifted and the softening of the lines?
In normal, it usually takes 2 weeks. This part is slightly faster. Usually day 7, you will start noticing the resistance. But it will take 2 weeks to fully settle. And the result will last around 3 to 4 months.
Okay, nice.
And how do you decide how many units someone needs? Obviously, it's individualized, or do you have set number of units for different areas?
It really depends on clients, like the muscle movement, how strong the muscle is. So I would say, it's very customized treatment. Yeah. So I always like landmark, assess their muscles, and then determine how many units that I'm going to use.
So one of the most common questions that we get just on the phones, even up front, is, well, how many units am I going to need? Can you give me like an approximate number? Would you say that there's an average for certain? Okay, since the forehead is the most common area and the kind of entry level area, I guess, for neuromodulators, what would you say the average amount of units? Because most people are charging by unit. That someone might need.
We do have like average units that we use. For example, like for forehead, I would say around 10 units. The glabella, which is the front areas, 12 to 20 units.
Okay.
And but again, it really depends on the muscle.
Everyone's anatomy is different.
Yeah, and probably where their baseline is and like if it's like more prevention or correction at that point too. Totally. Yeah, that is like really the number one question. They always like are trying to girl math it, right? How many units?
Didn't have a big surprise.
Totally. Which is like what's great about our clinic is that we do offer that consultation. where there's no pressure for them to inject, but they can get all of that information. They can take it home, girl math it, figure out how they're going to talk to their husband about that, and then come back in and decide they don't have to inject that day. I think before I worked here, I had never been to another clinic and received Botox where I had a consultation. Like it was just like, they just started it. Like, there was really no conversation. And then I went to another clinic and they said, how many units do you get? I had no idea. I just knew what I paid. So I was like, I don't know. This is what I pay. And they're like, okay, it's probably about this much then. But there was really no conversation around that. So I really like that you guys like take the time, walk through everything. And it's a nice place to have those questions answered too, especially if someone's new to Botox. Yeah, it's like more comforting experience, I feel.
Definitely.
So after getting their first injectable, what can a patient expect as far as like, is there a lot of swelling or bruising, bleeding, pain? What does that look like for people?
The swelling and bruising, it is normal and common, but it should go away after a few days. And pain is rarely, like you shouldn't have a severe pain when you go home. If you do, I think that's like you should contact your injectors and then go back to clinic for a further assessment. Not something that's normal. Like soreness is normal, but not like pain.
Yeah, I feel like it can be a little like very mildly tender.
Tenderness,
like you'll
soreness,
notice maybe when you're like cleansing your face that night or something, but I've never found it to last very long. Yeah.
And it also depends on whether the client has followed the pre-care instructions as well. Like we don't want
like butt thinners, like omega, some of the things will like alcohol, caffeine will does like increase risk of bruising. That is something that if you can avoid for like a few days before doing any injectables, it will really help.
And is that why you say no omegas like pre-injection is because of the bruising? Okay.
Yeah. Same as blood thinners.
Thins the blood.
Things.
Good to know.
So what would you say are your top 3 pieces of advice for anyone looking to get injectables for the first time?
So yes, the first one, get a consultation. Like what we mentioned, like our clinic do like a free complimentary consultation. So take advantage of it, get to know what you need, what be good for you, what options you have, and choose your injector really carefully. I think there's so many injectors in this industry right now. So really get to know your injector. And then second advice is have a really realistic expectations. Some people might think that they are doing like one-time session treatment and going to have like a facelift effect. Yeah.
I don't mean to laugh. Yeah.
Because I do have clients who are like, oh, am I going to like this? Something. Just have a conversation with your injectors. And the third one is definitely, look into the pre and post care and really follow those post care. That will help your result last longer. For sure.
What is your take on like preventative Botox, or some people call it baby Botox? Is that helpful or is it just like overhyped?
I think it's helpful. It will definitely prevent those lines from getting deeper because the way Botox works, obviously, is relax the muscle. So if you're not moving those muscles, those dynamic lines, it will make your wrinkles less.
It slows down the aging.
From forming.
Yeah.
And also, and if you start earlier, you also need less dosage and less frequently as well.
Right. I guess it's like that at that point, it's more like prevention versus like correction.
Yes.
Yeah. Which makes sense.
Also, it's good to catch earlier.
Yeah. Is there a point where you just like turn people away when it comes to preventative Botox, or?
I don't think I turn them away, but it's only when they have less really deep static lines, then it's no longer preventative. Like it will still prevent because it will still prevent the lines to get deeper, but then you probably need other treatments to go with it to help with those dynamic lines.
Yeah,
that's with a static line, not the dynamic line that much.
Yeah, that's typically like where things like cross treatment probably come into play, where it's like maybe you do some sessions of like RF microneedling in between and kind of build up that foundation and the structure of the skin to soften that and stimulate a little bit more collagen. And then like I've actually found with myself over the last 10 years of getting Botox, like I'm probably like 10 to 15 units less than when I first started, just from, really focusing on more anti-aging treatments and obviously skincare like retinol too. So yeah, you can move the dial backwards. It always makes me feel good. I'm like, yes.
Yeah, that's amazing. So I'd like to share with everybody what your approach is to injectables in general. So how would you make sure that clients leave your chair still feeling themselves?
For me, I think education is really important. I love to have that conversation, educate my clients on what they are getting, what the expectation is going to be like, what they're going to look like after this treatment. So yeah, so my approach is always like more like a slow and steady. I want to make sure they don't get like overfill or like over injected. I really listen to what they are looking for and build like a customized treatment plan within. And also I think it's also important to incorporate other treatment like you talk about, like microneedling or like lifestyles, skincare products, to kind of help everything.
Yeah, because at the end of the day, you're working on the muscular layer and still doesn't change the skin's integrity or how it's healing or how it's making collagen. And
Yeah. And just the appearance, like the texture of the
Yeah.
skin, that can really, we look at things like when we do IPL, for example, that's like really always one of my favorite before and afters because you see how much sun damage can age skin. So it's like working on, the epidermal layer and the melanocytes and softening and reducing the amount of pigmentation that's visible. And then doing something like Botox, it's like, that's like,
Yeah.
And also like hydration can
Yeah.
also help your Botox last longer. Supplement like zinc can also be beneficial for helping your Botox last longer as well.
Oh, really?
So what does zinc do that helps?
Zinc generally is really good for skin. Research actually showed that zinc prolong the Botox.
Okay. So get your zinc,
Get your
everybody.
zinc.
Are there foods that are high in zinc? Would that help?
Yeah. So you can have your pumpkin seeds, like oysters, seafood and stuff are high in zinc. And then, but probably not quite enough you're not going to eat that every single day. Definitely
Slamming a dozen oysters a day.
getting your supplements is probably good.
Yeah,
and
fair.
honestly, a zinc supplement doesn't hurt it's great for the immune system, great for skin. It's anti-inflammatory. It's going to speed up healing. And if it increases the longevity of your Botox investment, heck yeah.
Yeah, totally. Winnie, do you have a favorite treatment or a combo that gives like the most kind of wow factor or like transformation?
I think that my favorite combo is still Botox and filler, like neuromodulator and filler. It's just because fillers, you see the instant result. And with neuromodulator, after 2 weeks, it will make your filler even looks better. And you will just honestly just look more refreshed. You have that subtle transformation. And it just looks really good. But I also, something I want to try is Sculptra and filler. Because Sculptra, you stimulate your collagen, build a foundation, but it does takes longer to see the result. But with filler, you can see it right away. So I think with those two combination together, I think clients will really love the result.
I agree.
Yeah, those are like two very powerful options to kind of combine. Yeah.
Yeah, very transformative, I'm sure.
Lip flips, those are pretty popular treatments. Like, what does that look like? Maybe explain that a little bit.
So lip flip is a neuromodulator treatment. It will relax your upper lips. So you will make your upper lips look bigger. Instead of curl in, it will just appear bigger. And with filler, obviously adds volume to your lips. Overall, you will have double of the benefit and looks bigger and more hydrated lips. As well, lip flip prevent migration. I think that's also another thing that people forget. The flip can also help prevent the filler from migrate to different places. And then so you will prevent you from having those shelf on top of your lip.
And it's not very much, there's not very many units that go into a lip flip, right? Like
Usually
4
to 6 units.
Yeah.
That's all you need.
Which a lot of our clients love to do. I think it's sometimes it's the gateway to filler in lips. Is let me get a lip flip first, try this out, and then maybe they'll move into filler. Maybe they won't. Some people just love a lip flip. Yeah. I feel like if your lip curls under when you smile or you have a gummy smile, a lip flip is really nice. It can really be corrective for something like that.
Yeah, absolutely. What is one trend in this industry right now that you're just super over or that you're really loving right now?
I think now actually I found that injecting industry was slowly steering away from it, which is really good. But I remember back a year ago, it was Russian lips, those really overfilled pillow face. It was really a lot of people were trying to get that look. But now it's less now, which is really good. Yeah, because I don't know. I like more the natural look. So for me, it just looks a bit not balanced.
Yeah.
And I was finding too, a lot of the Russian lips, they might look good in the moment, just post injections, but then as they heal and they don't stay that shape. And so then you end up, like you said, with more of that pillow lip look.
Yeah, that pillow face, I feel very, if you look on what's trending on TikTok, it's we're moving way out of that.
Yeah.
Almost like the pendulum has swung far the opposite direction, where it's like definitely things like Sculptra are coming into play more, and like more of like that natural appearance, less of like that overfilled, 2018 kind of vibe.
And just more a focus on skin too, finally, you know, like,
so I think like more like regenerative, natural treatments are what people are really in and then doing right now. Like Sculptra, like you mentioned, PRF is also one of them. That's really good that you use your own natural blood to spin it and have the growth factors and put it back into your body. I noticed a lot of people are more into that now.
Yeah, more natural approach.
Because you've had some really great before and afters with like under eye and PRF, which is really nice for, you know, anyone who's on the fence about filler in the under eyes. I feel like PRF is just like so nice to really build the collagen too, which is so important.
Is there anything that you wish everyone understood about aging and beauty?
I think I wish everyone understand that aging is like not scary and then we cannot really stop aging. But with the injectables or other treatments, you can slow the aging process and age more gracefully. Also, I think just combining skin treatments, injectable, wellness, all those things kind of go together and can just make people age gracefully.
Graceful aging.
Yeah, I feel good about the aging process.
Yeah. There's nothing wrong with aging. It's just we're trying to stay fresh, rested looking, and more confident.
So I think honestly like beauty isn't just like getting every single wrinkles or lines on your face, but it's about like balance, confidence, and just feeling like yourself, but just feeling like your best version of yourself.
Love that.
Yay. Thanks, Winnie.
Thanks, Winnie. So anyone who's maybe interested in dipping their toes in the water of injections, Winnie does offer free consultations. You can have a full hour, just you and her, to have all your questions answered. You have no pressure to proceed with treatment, but it is available to you if you'd like. And that is all for today. So thank you guys so much for listening. Please like, share, subscribe, and we look forward to seeing you the next time. Bye, guys.
Bye.